Hello, my name is Mariluz, and I'm working with Shashank and Noah, and as part of the team Don't Move for the final project in the imaging class. Today we're gonna talk about artifacts in MRI imaging, and without further ado, let's get started. So an artifact is an error or distortion in an image that's produced by a magnetic resonance imaging scan, and it can affect the accuracy of medical diagnosis. When they're produced by the scan, they can be difficult to identify because you don't know what's real, comes from the real image, or what real physiology, or what comes from the artifact. And these artifacts come from various sources, including scanner hardware, the imaging sequence, or the patient's anatomy. So knowing these artifacts is important to be able to avoid false diagnosis and also to hopefully eliminate or reduce them. So we want to know how they're produced and what their source is. There's many different types of artifacts. For our project, we chose a couple of classes, which is like wraparound artifact and motion. And then within motion, 3 types of artifacts. So for the wraparound artifact, this is a particular manifestation of aliasing, which is the erroneous assignment of signal frequencies when the digital sampling rate is too low. And then motion artifacts are very frequent in MRI, and they have always been problematic since this clinical modality started. This is because MRIs take a long time to sequence, to collect enough data to form an image. And during this long time, there's a lot of physiological motion going on. So the artifacts appear from a combination of the image structure, the type of motion, and the specifics of the MR pulse sequence and the K-space acquisition. And we're going to talk about ghosting, rotation, and elastic motion today.
So now I'm going to talk about some of the MATLAB simulations that we performed to represent these, to show these artifacts and how these usually happen in the image. The first artifact that I'm going to talk about is a wraparound artifact. This one occurs when the scanned area of the human body exceeds the predefined field of view. Areas outside the FOV cannot be properly encoded relative to their actual position, resulting in this wrapped information reappearing on the other side of the image. Usually this occurs along the phase encoding axis, but it might sometimes also occur in the frequency encoding direction. On the figure or image towards your right, you can see that the object is larger than the phase encoding K-space. And as a result, the part which is outside the K-space usually wraps around and ends up like overlapping on the original object image. This can be recognized, as it says, like over the anatomic parts of the areas of interest. And how we simulated is basically, given we generated an MRI image, original image, and we produced an artifacted image by taking the original image and shifting it by a D columns. After we had the artifact image, we overlaid it on top of our original image. Now, as you can imagine, when we do that, the image contrast over the wrapped part will have intensity more than the other parts of the image. To fix for that, we normalized the wrapped area and sort of generated this, and we were able to generate this beautiful wraparound artifact image, as you can see in the bottom right corner. The next artifact that we simulated was the ghosting motion artifact, which is a type of structured noise that appears as repeated versions of the main object. Usually this occurs because of signal instability, where the K-space is not acquired in a regular pattern between the pulse cycle repetitions. It's most commonly seen along phase encoding direction, but can also occur in the frequency encoding direction. The image is an example of ghosting artifact along the phase encoding direction. How we simulated this was we generated 3 images. The first was a phantom image, just a regular phantom in MATLAB. The second was the original image shifted by a distance d towards the right or up, depending on what kind of ghosting we're trying to go for. There's 2 types of ghosting here, horizontal which is in the phase encoding direction, and vertical, which is in the frequency encoding direction. And once we converted each of these images to their corresponding K spaces, and finally we interleaved them one over the other with the following scheme. As you can see, we took each row from one row from each of the K-space images and interleaved them in this. For the one on the left shows for the horizontal ghosting, and one on the right shows for the vertical ghosting.
So moving on to the next type of motion artifact, we did a rotation artifact. This is a really common artifact in head scans, with the patient's head being able to rotate side to side. And so we simulate that with the Shep-Logan phantom that's rotating. And how we create the motion artifact is that we take each frame and we partially sample it in K space. We go through all the frames, and then we aggregate all those samples into a single full K space. We reconstruct that, and that's our motion artifact image, which you'll see soon. So we did a couple of experiments with that, testing a sequential versus a centric Cartesian sampling scheme. And then we also test a range of rotational velocities to see how velocity affects the quality of the image. So first we'll look at the different Cartesian sampling schemes. We have sequential Cartesian, which is when you start in the corner of K-space and take lines passing through the middle at the center of time. And that is shown, the results of that are shown in the top row here. And you can see that the reconstructed image is, basically in line or orientation-wise with the static image. And that happens because it's basically taking a time average of the image, where for the centric sampling scheme, which starts sampling K-space from the center row, that acquires the center of K-space, which is where most of the image is, right at the beginning. And so it captures the very first couple of rotations, which is why you see it tilted. So we also attempted to do a spiral trajectory, which is partially successful, and we wanted to include it because it had some interesting results. So we created a sampling scheme where we start at the origin and sample in a spiral outwards. So we acquired K-space with most information at the center. And because most of the information was at the center, it got a lot of the low frequency data, which is why you can see the outline of the head pretty well. But we had a hard time projecting the polar coordinates onto a Cartesian grid. And so a lot of the details were lost. But according to literature and studies that have been done on this before, the spiraling sampling scheme is supposed to be really good at correcting for rotational motion. So I think in future work, we would try to iron out some of those difficulties. And then additionally, we tested the effect of different rotational velocity. So on the left here, we have a phantom rotating at 10 degrees per unit time, going all the way to 40 degrees per unit time. And you can see pretty clearly that the degree of blurring increases with increased velocity. And for a quantitative metric, we calculated the structural similarity index between the moving image and the still image to get a sense of how similar the images are, basically. And you can see that that decreases with increasing velocity as well.
So finally, the last artifact that we simulated is the elastic motion artifact, which typically includes stretching, compression, and shearing, in addition to rigid body motion. So we took an example of the heart, where we have a heart beating, so contracting and relaxing, in the video on top at a slower pace, and in the video at the bottom at a faster pace. And basically, our simulation has 4 steps. We first create the phantom of the heart. Then for each frame, we take a certain number of rows, and then in the K-space, and then we have a final K-space image that has rows from every frame, and then we use that final K-space to reconstruct the image with the inverse Fourier transform. So the sampling scheme I'm using is exactly what Noah just described. So I'm not gonna go in detail again for the sake of time. But at the top, we have a sampling top to bottom, where we have those Cartesian sampling scheme from top to bottom And for each, in this case, we take 8 rows from each frame for a total of 32 frames. And then at the bottom, we have the sampling scheme where you go from the center and outwards. And we can observe that the reconstructions vary depending on the sampling scheme. Finally, we repeated that with 9 cardiac cycles and the same number of frames, so it goes faster. And with similar sampling schemes, we can see that the artifacts change because as it goes, the heart beats faster. We expect to see a more noticeable artifact. Now, Noah's gonna wrap up our presentation with some final notes.
Yeah, so in summary, we tested wraparound and motion artifacts. The wraparound arises when the object moves out of the field of view, and you see those ghosting images. And then when we applied motion to the objects, you saw blurring in the direction of the motion. We also saw that because the blurring is basically an altering K-space as the scan is being taken, that as you increase the velocity, it worsens the blurring. And also we started to show that K-space trajectories significantly affect the reconstructed image. So now that we know how to simulate these in the future, it would be a great thing to try to correct them. We can minimize the degree of motion by educating patients on the importance of stillness or stabilizing or sedating them. We could suppress signal from moving tissues. That's commonly done in blood to remove the blood signal from an anatomical image. We could adjust the imaging sequences as we showed. That faster K-space acquisition helps reduce the effect of motion. And finally, there are plenty of ways to detect and compensate for motion, such as cardiac gating, sequences that actually correct for motion as they're taken, and then lots of post-processing that can be done to fix rotational artifacts by co-registering images. So thank you for listening. If you have any questions, please email us. Our names are at the beginning of the video. And thank you for your time.
Thank you.